Picture an 8-year-old boy with autism who hasn't spoken in months. His parents have tried everything: speech therapy, behavioral interventions, specialized programs. Then one afternoon, a golden retriever named Bailey enters his therapy room. The boy reaches out tentatively, touches the soft fur, and suddenly whispers a single word: soft. This breakthrough moment isn't magic, it's neuroscience in action. Today we're exploring how our 10,000-year friendship with dogs has created one of medicine's most remarkable therapeutic tools. Research now shows that therapy dogs improve social communication in 84% of autism cases, while reducing depression in dementia patients by 30 to 50%. These aren't just heartwarming stories. They're measurable neurological transformations that reveal how evolution designed the perfect healing partnership between humans and their oldest animal companions. 10,000 years ago, wolves began following human settlements, and something extraordinary happened. Over millennia, humans and dogs didn't just live together, they evolved together. Scientists have identified 311 genes that underwent parallel evolution in both species, all affecting neurological processes and behavior. This shared genetic journey created something unique in the animal kingdom, a species that can read human emotions as naturally as we read each other's. Brain imaging studies at Emory University reveal that dogs process human faces using specialized neural pathways. Their right amygdala activates specifically when interpreting our expressions. They distinguish between happy and angry faces, recognize individual humans even in photographs, and adjust their behavior based on our emotional states. No other animal, not even our closest primate relatives, shows this level of emotional attunement to humans. But here's where it becomes therapeutic. When a dog gazes into a human's eyes, both brains release oxytocin, the same hormone that bonds mothers to infants. Studies show oxytocin levels increase 300 to 500% during these interactions. Simultaneously, cortisol drops, serotonin rises, and dopamine surges. The right dorsolateral prefrontal cortex, crucial for emotional regulation, shows 15 to 25% increased activation. These aren't subjective feelings, they're measurable neurochemical cascades that explain why a single therapy dog session can match the effectiveness of multiple traditional therapy sessions. For children with autism spectrum disorder, the social world presents overwhelming complexity. Human faces change constantly, voices carry multiple meanings, and social rules seem arbitrary and confusing. Dogs offer something revolutionary: predictable, patient, non-judgmental interaction that bypasses these challenges entirely. The therapeutic mechanisms work on multiple levels. First, there's deep pressure therapy. When a dog rests against or lies across a child's lap, the weight provides proprioceptive input that calms the nervous system. This isn't just comfort, it helps regulate the disrupted excitatory-inhibitory balance characteristic of autistic brains. Trained therapy dogs recognize pre-meltdown behaviors, hand flapping, rocking, rising anxiety, and intervene through gentle pawing or positioning, providing sensory anchoring before escalation occurs. A 2024 meta-analysis of 45 studies involving 1,200 children revealed striking results. Therapy dogs reduce hyperactivity scores by 4 points, decrease irritability by 2.5 points, and most remarkably, increase vocabulary by an average of 20 completely new words, while expanding use of existing words by nearly 60. These children aren't just calmer, they're communicating more. Consider how this works in practice. During a typical 30 to 60-minute session, a child might brush the dog's fur, providing proprioceptive feedback through resistance. They practice giving commands, naturally developing verbal communication and turn-taking skills. Walking the dog offers vestibular stimulation while teaching spatial awareness. Throughout, the dog remains patient, never frustrated by missed social cues or unconventional behaviors. The child learns that interaction can be safe, predictable, and rewarding. What makes dogs particularly effective is their role as social catalysts. Children who won't make eye contact with humans will gaze at dogs. Those who avoid touch will stroke fur. Silent children speak to give commands. The dog becomes a bridge to human interaction, with 97% of participants maintaining program adherence far higher than traditional interventions. In memory care facilities across the nation, another transformation occurs daily. An elderly woman who no longer recognizes her own daughter suddenly smiles as a therapy dog enters her room. She may not remember the dog's name or previous visits, but something deeper responds, an emotional memory that transcends cognitive decline. Alzheimer's disease progressively destroys the brain's ability to form new memories and retrieve existing ones. Language fails, recognition fades, and confusion dominates. Yet therapy dogs reach patients through pathways that remain intact long after cognitive function deteriorates. They communicate through body language, touch, and emotional presence, exactly the channels still accessible to dementia patients. The neurological impact is profound. Studies document depression reduction of 30 to 50%, with agitation decreasing by nearly 30% when therapy dog programs are implemented. Unlike human visitors who may trigger frustration when patients can't remember them, dogs provide immediate unconditional comfort without requiring recognition or complex social navigation. Dogs trigger what researchers call biographical memory activation. The tactile sensation of soft fur awakens deeply embedded memories, childhood pets, farm animals, moments of joy from decades past. These aren't conscious recollections, but emotional echoes that momentarily lift confusion's fog. Patients who haven't spoken coherently in months suddenly share clear stories about dogs from their youth. The therapeutic protocol involves structured activities adapted to cognitive capacity. Simple command practice, sit, shake, stay, exercises executive function. Grooming activities maintain fine motor skills. Walking programs preserve physical mobility. Reminiscence therapy uses dogs as prompts for storytelling. Throughout, the dog's presence anchors patients to the present moment through sensory engagement. Warmth, breathing rhythm, the simple joy of giving treats. Perhaps most poignantly, dogs preserve dignity when memory fails. They don't judge confusion, repeat questions patients can't answer, or show disappointment at forgotten names. They simply offer presence, creating moments of connection that transcend cognitive impairment. Families report that these visits often represent their loved one's most lucid, peaceful moments, times when the person they remember briefly resurfaces. The evidence supporting animal-assisted therapy has reached critical mass. Over 2,800 publications document benefits across populations, with the therapy dog industry growing to $110 million annually, employing 50,000 certified therapy dogs nationwide. Meta-analyses consistently show moderate to large effect sizes for anxiety reduction, social functioning improvement, and measurable physiological changes including blood pressure reductions of 10 to 15 millimeters of mercury. But why dogs specifically? Comparative studies reveal crucial differences. While horses excel in trauma therapy due to their imposing presence that demands respect and focus, and cats provide companionship, dogs consistently outperform all alternatives, including sophisticated robotic pets. A 2023 study directly comparing real dogs to robotic dogs found only living dogs produced positive cardiac autonomic changes and improved social behaviors. The training investment is substantial, $2,000 to $5,000 over 12 to 18 months, but creates highly specialized therapeutic tools. Dogs learn condition-specific skills for autism, deep pressure therapy, behavioral interruption, and crowd control in overwhelming situations. For dementia, they master remaining calm during agitation, providing routine cues and gentle redirection during confusion. Success rates reach 75% for therapy dog candidates, with programs following strict protocols ensuring both effectiveness and safety. Session structure matters tremendously. Interventions under 15 minutes show minimal impact, while those exceeding this threshold demonstrate substantial benefits. Optimal programs involve 8 to 12 weeks with approximately 10 hours total contact time, typically in 30 to 60-minute sessions, balancing engagement with avoiding overstimulation. We stand at a remarkable convergence of evolutionary biology, neuroscience, and clinical practice. The same coevolutionary journey that transformed wolves into humanity's best friend created a therapeutic tool more sophisticated than we ever imagined. These aren't simply pets providing comfort, They're highly trained medical interventions triggering specific neurological cascades that address core symptoms of complex conditions. For children with autism, dogs provide patient bridges to communication and social connection that traditional therapies struggle to build. For elderly patients with dementia, they anchor identity and provide comfort when cognitive function fails. The mechanisms are measurable: oxytocin surges of 300 to 500%, cortisol reductions with large effect sizes, prefrontal activation increases that enhance emotional regulation. As healthcare systems worldwide recognize these benefits, integrating therapy dogs into treatment protocols, we're witnessing validation of an ancient truth. Sometimes the most sophisticated medical intervention has 4 paws, a wagging tail, and an evolutionary heritage perfectly designed to heal human hearts and minds. In our age of complex pharmaceuticals and high-tech interventions, perhaps our 10,000-year-old friend offers the reminder that healing often comes through connection, the kind only possible when gazing into the patient, loving eyes of humanity's first and most faithful therapeutic partner.